At Howard County General Hospital, we've started a division of population health, and we are focusing on partnerships outside of the traditional hospital base.
It helps us to make a difference in the lives of our members and in the lives of people who come, because we're just not interested in the spiritual well-being of our members, but we're interested in the holistic needs of our people.
People naturally are going to fall along some sort of spectrum. You're going to have individuals who are relatively healthy and have no chronic conditions or needs, all the way up to those who have multiple chronic conditions and need help with everything from their clinical care to even social needs such as transportation, food, and housing.
Learning how to manage and improve chronic disease in our community is no longer a choice. It's a reality. And when we look at why people die early, chronic disease is at the top of the list.
Journey goes out into the community and they screen individuals who might be at risk for developing certain diseases.
We do things like blood pressure screenings, pre-diabetes assessments, we do body mass index assessments with them, and then depending on the venue that we have, we will also have some mental health services for them as well.
And then based on the risk profile, have recommendations and then can help individuals enroll in evidence-based classes to better manage those conditions.
We discuss everyday type of management of their health conditions. So we'll talk about problem solving, decision making. Every week we do action plans, so it helps that person focus on what's important to them.
There are a lot of takeaways for me. Number one, I have learned how to work with my chronic illness. And secondly, it has increased my awareness of my physical activities, how just walking an extra 10 minutes a day can make you healthier. And the program, with some of our take-home activities, bring a wholeness to me.
The other piece of Journey, which I think is a really valuable asset to the community, is the Member Care Support Network. And that is lay leaders within the congregations and faith-based organizations who actually volunteer to be community companions.
My mother had been in and out of the hospital a number of times because of her heart condition. And somebody from the hospital just follow up to see how the patient is doing. I told him that one of the things that my mother missed was she loved church.
This is today's reading. It says Psalm 100.
And once she became ill and it limited her mobility, she couldn't get to church. And so this was an opportunity for her to have someone come in and have prayer with her, read scripture or Bible study.
I am the community companion for our congregation. And so she asked if I would want to sort of travel alongside with Miss Amy for a little while, and I said sure.
I've seen the change in my mother. I know it really helps strengthen my mother's faith and helps her deal with her discomfort.
So maybe it will impact the economics of the hospital and its work, and that's good. The bigger societal impact on this is people see other people working together more, and they just start to change their hearts and their minds, and let that be another benefit that comes out of this program.
Today, healthcare is a team sport. We can't do it by ourselves, it's too costly, so we all need to reach out to the faith-based organizations, the social service agencies within a community, and figure out how to be the best we can, not as silos, but in a collaborative effort that is really looking at who can do it best and how do we access that in a smart way.